Hello. The other day, a parent asked me, what can I do to teach my child to be responsive to his name? I call him and he doesn't respond. He doesn't seem to know what his name is. Well, first order of business, the first issue to be concerned about is what is the child's age? Children tend to not have a sense of self-identity until roughly around age 2. So prior to that, it's a question of, 1, are the ears functioning correctly? So a child needs to be screened with a hearing test to make sure that the child has adequate hearing. Now, it is important to understand the difference between a tympanogram and an ABR. A tympanogram is simply measuring the vibration responsiveness of the tympanic membrane. That has nothing to do with hearing. So it will never help to assess a child's ability to hear by doing a tympanogram. Instead, they need to do a more advanced study called an ABR, which will measure the effective ability of the 8th cranial nerve to hear sounds. So until that's done, we can't know if a 3-year-old is hearing or not. So when we talk about measuring whether or not a child can hear and understanding what we're saying to them, age of the child is very important. Babies start being responsive to eye contact within the first days of life. Babies start being responsive to the sounds we make very quickly thereafter. However, they don't really understand the meanings of the words we say. But roughly by the time a child is 1 year old, they know a few words, which is why in every culture, the most common word that a 1-year-old speaks is no. And why would you think that is? It's because that's probably the most frequent word the child heard parents say to that child. No, don't do this. No, don't do that. No, no, no. So the child learned, this is an important word, so I'm going to memorize this word and start repeating it. So if we're wondering, why isn't my child understanding what I'm saying? If the child doesn't understand my words, then we have to do a hearing screening to assess the problem. And that means finding a medical expert who's able to do a hearing evaluation for your child. First, there's a clinical screening that I do at the clinic. And then on top of that, to see how profound the problem is, we need this test called an ABR to get an accurate assessment of how the 8th cranial nerve is functioning. However, there are 2 other considerations. It is very common that parents think that if a child is now 3 years old and he doesn't know his name, it's because he's being stubborn. And that's usually not the case, but occasionally it can be the case. It's more probable that there's some other variable at play that's causing the child to have delayed ability to use language. So an entire screening needs to be done, both of the family history and the individual child, to get an accurate assessment about what needs to be done in order to help the child be responsive to language. Thank you.
يلبس بوطي. أنا رح آخذ البوط فردين من الأرض. أنا أخذت الفردة اليسار. أول شي بدي أفتح الزائقة. أمسك الفردة هيك، أمسك الزائقة بأصابعي. أنا فتحت الزائقة. يا سلام. هلا بمسك الفردة البوط بإيدي اليمين، برفع رجلي مشان البس البوط، بحط رجلي فوق. هلا بمسك الفردة، بحط رجلي بالبوط. هلا بقى بدي لزق اللزاقة. بمسك اللزاقة بإيدي الثانية وبلزقها هيك. أنا لبست فردة البوط اليسار. هلا بدي آخذ الفردة اليمين، باخدها من الأرض. أيوة يا سلام. هلا بقى بدي فك اللزاقة. بمسك هيك اللزاقة، هلا بمسك فردة البوط بإيدي. يلا برفع رجلي يمين مشان حط البوط برجلي يمين. أنا عم فوت البوط برجلي. يلا هلا بدي لزق اللزاقة. بمسك اللزاقة وبلزقها. أنا عم لزق اللزاقة. أيوة أنا لبست بوطي.